Knock, knock. How you doing, sir? My name is Ernie, and I'm going to be your nurse today. I verified the doctor's orders, and they've ordered an assessment. But before we begin, could you please verify your name and date of birth for me? Patient verifies. Okay, I'm going to close the curtain for privacy. Wash my hands for safety. Put on some gloves. Okay, sir. So the doctor ordered a full head-to-toe assessment. So I'll be asking you some questions and performing some tasks. Okay? First, I'm going to stand off at a distance, making sure, looking at the head and the face, and making sure the head is of normal size and the eyes are symmetrical with the ears. Okay? Then I'll begin by palpating and inspecting the head, palpating and inspecting the scalp. I'm looking for any lesions, any injuries, any parasites, and also checking the texture and distribution of the hair. Okay, everything looks normal there. About looking at the face, now I'm going to test cranial nerves 5 and 7. I'll ask the patient to make several facial expressions, such as raise your eyebrows, close your eyes, smile, puff your cheeks, frown, and to clench real hard, clench their teeth real hard. Okay, everything looks normal there. While I'm there, I'm gonna palpate the temporal artery. Yeah, everything's good. To the other one. Okay, and I'm also gonna palpate the temporal mandibular joint, the TMJ. Okay, so as I touch the joint, I'll ask the patient to open and close their mouth. You shouldn't feel any crepitus. Okay, so palpating the joint, it's opening and closing the mouth. Everything's normal there. Okay, moving on to the eyes. First, I will check his peripheral vision by doing the confrontation test. I'll ask the patient to cover their eye with one hand while focusing on my nose, and to tell me when they see my finger as I lift them up. So pretend we're going to close his eyes. He's looking at my nose. He's going to tell me when he sees it, okay, sees it, and he sees it, and I will do that on the other side as well. Okay. After that, we were going to test the 6 cardinal movements of the eyes. This is going to test cranial nerves 3, 4, and 6. Okay, I'm going to ask the patient to only follow my fingers with their eyes and not their head. Okay, so I'm going to start from the middle, go to different sections, and they should be able to follow my finger with no problem. Okay, so I'm going to start from the middle, it's following, to the side, following, to the other side, following. Same thing on the other side. So back to the middle, side, and side. Okay. Then I'm going to test for perla using a flashlight or pen light. I'm going to turn off the lights, and I'm going to test his eyes reaction to light, and they should react equally. So I'm going to shine the light on one side of his eyes, and his pupil should constrict, and then the other opposite pupil should constrict as well. Okay, so it'll be something like this. So I'll come from the side. Okay, everything good there. Okay, so everything should constrict equally and react to the light. Okay, moving on to the nose. The nose, I'm making sure his nose is symmetrical to his face. I'll be looking inside the nose, preferably with the pen light. Okay, so I'll take the light and I'll check inside the nostrils, making sure everything's nice and pink and moist. The septum is not deviated, and there's no obstruction in there. Okay, everything's normal there. Then I'll do the same with the mouth. Okay, I'll take my pen light, I'll ask them to open their mouth. I'm looking inside the mouth, everything is pink and moist. Looking at the back of the throat, making sure there's nothing abnormal in there, no infections. Looking at his gum, at his teeth. Okay, and while I'm there, I'm going to check cranial nerve 10. I'll ask him to say ah, okay, and the uvula should rise. Okay, that's testing cranial nerve 10. Then cranial nerve 9, I'll get a tongue depressor and I'll tap the back of the throat to activate the gag reflex. So that's testing cranial nerve 9. And ask him to move his tongue from side to side. That's testing cranial nerve 12. Okay, so we're done with the mouth there. Then I'm moving on to, while I'm here, I can check his lymph nodes. Okay, for checking the lymph nodes, I'll be palpating the lymph nodes in a nice tapping circular motion. Okay, shift them over. At first, I'll check the preauricular, so right in front of the ear. Post-auricular, right behind the ear. Okay, the occipital in the back of the head. I'll do this on both sides. Okay, the tonsillar, right here. Okay, submandibular. Okay, submental, right under the chin. Okay, anti-cervical, right where the muscle, right in front of the muscle. Okay, post-cervical, right behind the muscle. Everything feels normal. And subclavicular. Okay, everything feels normal there. And then while I'm on his neck, I can palpate the carotid artery. So we do this one side at a time. We do not do both at the same time. Okay, so we palpate. Okay, nice and strong. Nice and strong. Okay, so now I can also take the carotid arteries. I'll take the bell side of the stethoscope, and I'll be listening for breathing. Right. So I'm going to ask the patient to take a deep breath, release it, and hold his breath. Okay, sir, can you take a deep breath, release, hold it for me? Okay. There was no breathing there. Okay. Since we're still on the neck, I'm going to test cranial nerve number 11. I'm going to put my hand on his chin and ask him to push to turn his head against my resistance. Okay, turn, sir. Okay, do the same thing on the other side. Okay, and then I'll also put resistance on his trapezius muscles and ask him to shrug, and he should shrug with no problem. Okay, shrug, sir. Okie dokie. Okay, moving on to the thyroid gland. Okay, thyroid gland. I'll go behind him and I'll test it from behind. So I'll come behind, I'll push him by the trachea. So put my hands on his trachea. I'll ask him to swallow. You can swallow. Okay, and another way to test it is I can push the trachea to the side and feel if there's the lobe is there. Okay. Pushing it to the side, nothing there. Everything there is normal. Okay, now we're moving on to the cardiovascular. Okay, I'll check the 5 points of the heart. So on the right sternal border, second intercostal is the aortic. On the other side, second intercostal is the pulmonic. On the third intercostal is Earth's point. On the fourth intercostal is the tricuspid. And midclavicular line on the fifth intercostal is the mitral. Okay, this is the point of maximum impulse. This is where you feel the pulse the highest. Okay, and then I'll also take the same 5 points. First, with the diaphragm in my stethoscope. Okay, so aortic, pulmonic, Earth's point, tricuspid, and the mitral. So the S2 sounds are heard more strongly in the aortic and pulmonic. Earth's point and Earth's point and tricuspid, you hear S1 and S2, and in the mitral you hear the S1 the strongest. Okay, then I'll turn the stethoscope to the bell side, and I'm going to listen for any murmurs using the same points. Okay, so aortic, pulmonic, first point, tricuspid, and mitral. Okay, I heard no murmurs, no S3 or S4 sounds. Okay, then I'll palpate the brachial artery, so right by the elbow. Okay, the radial artery, right by the wrist. Okay, everything right there. The popliteal is behind the knee. The dorsalis pedis above the foot, and the posterior tibialis right by the ankle. Okay. While I'm still focusing on the chest, I'll listen to his breath sounds to check out his lungs. So I'm going to check different points of his lungs with the diaphragm of the stethoscope. I'll ask the patient to take a deep breath and exhale every time I move that stethoscope. Okay, so I'll start from the top of the lungs. Deep breath. Deep breath. 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 Okay, I didn't hear any wheezing or ronchi or any bad sounds. Okay, then we'll do the same on the back side of his lungs. Take the shirt off. Around. Okay, here we wanna listen to the sounds away from the scapula, because then the bones are in the way. Okay, so we're gonna pick 10 different spots. Same thing. Ask him to take deep breaths. Breath. Breath. Okay, I didn't hear any bronchi or any wheezing. Okay, while I have him on looking at his back, I'll check the CVA for tenderness. So I'm going to find around the 12th rib. I'm going to percuss on the CVA and see if he feels any pain. Okay, so let me know if you feel any pain. So good, good. All right, no pain. Coming back to the front. Normally, you would ask the patient to lay down, but since obviously I can't handle laying down without you watching, I'll do the abdomen while setting up. Let's pretend he's laying down. Okay, first you would inspect the abdomen while he's laying down. You make sure everything's symmetrical, the umbilical is within line. Looking at the skin, making sure there's no lesions, no abrasions, everything's nice and normal. Okay, then I will auscultate the 4 quadrants of the abdomen, making sure all the sounds are normal. Okay, so I will start from this side, go in a clockwise. Okay, first with the diaphragm. Sounded normal. Then I can listen to the vascular sounds with the diaphragm, with the bell of the stethoscope, excuse me. So I'm going to check the aortic, the 2 renal arteries, the two iliac arteries, and the femoral arteries are by the groin. Okay, so we're listening for Brugge again, just like up top. Okay, so aorta, renal, iliac, and the femorals will be down here. Okay, I didn't hear any broom. All right, then moving on to percussing the abdomen. So same thing. We'll go in there and just tap, listening for tympani. Everything's sounding normal. Then I will palpate the abdomen, do light palpation first, so I wouldn't go in too deep, and then deep palpation. Alright, so light palpation, I'll ask them, look at their face and make sure, where I press, if you can tell if they grimace, if they're having any pain. Alright, so please let me know if this hurts, sir. So just gently press. No? Okay. No? Okay. No? Okay. Then I'll do some deeper palpation and do the rebound test. I'm going to press in harder and let go and see if that causes any pain. Okay? Please let me know if this hurts, sir. So I'll press in deeper. Good. 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 Okay. Then I'll move on to palpating for the spleen. Like in normal people, regular healthy people, it's pretty hard to feel the spleen. Again, let's pretend he's laying down. I'm gonna hold on to his ribs, and I'll follow the costal edge, and just press in real deep. Ask him to take a deep breath. Press in real deep, and it would be pretty difficult sometimes to palpate the spleen. Okay, so at this point, I'll ask the patient to sit back up, have him sit up, and I'm going to test some more neurological aspects. So let's pretend he's sitting down to test the motor function of the upper extremities. I'll ask him to tap his thighs, alternating between the palm of his hand and the back of his hand. So something like this. Okay, do it as fast as you can, and you should be able to do it coordinated. Okay, another motor function test is I'll ask the patient to, with the heel of his foot, drag it up and down on the opposite shin. Okay. From there, I'll also test some of the reflexes. So the bicep tendon reflex, we find the bicep tendon while the arm is hanging. You tap it with a little hammer. So tap it, and they should be able to have a nice reflex action. And then by the patella tendon, same concept. You let the knee hang, the leg hang. Excuse me. Find the patella tendon. You're going to tap it with the hammer, and when you tap the area, their leg should flex. Okay, so something like that. Okay, then I'll take the tuning fork, and then I'm going to test the vibration on his big toe. So I'll tap the tuning fork, place it on the patient's top of his toe, and he should be able to feel the vibration equally on both sides. Okay, lastly, I'll ask him to stand up, and I'll test him with the Romberg's test. So I'll ask him to stand up, ask him to close his eyes for me, and I'll have my hands next to him, and for about 20 seconds, just watch them. There'll probably be some swaying, but not too much swaying. They shouldn't be able to touch my hands Okay, and that means if they touch your hand, that means they have balance problems. Okay. Lastly, I'll ask the patient to walk about 20 feet in front of me just to watch their gait. So walk like normal. Okay, and then I'll ask them to come back towards me, walking, making their heel touch their toe, just like the alcoholic test. Okay, so heel to toe, heel to toe, heel to toe. And then that would conclude the test. I'll ask my patient to sit back down on the bed, make sure they're comfortable, and provide them with the call light and let them know if they need me for anything to please call the call light. All right, so that concludes the test. Please let me know if you have anything else, any questions for me? No? Okay. Then you have yourself a good day. I'll wash my hands, close the door.